Pharmacy Prep. Best of the Pharmacy Prep 25 difficult questions. Those are frequently tested in the pharmacy board exams. So let's start. Which of the following is a valid physician DEA number, or which is a drug enforcement agency number? A, AB1234563, B, AC4567895, C, BB2468133, and D, BD1357923. So can pause the video and try to calculate what is the best or valid physician DEA number. Correct answer is A. So here next I like to show you how do you get that correct valid number by using these following methods. So here number is 1 AB1234563. So if you break down the DEA number has first two letters and then six numbers, and then last one is a one number. So first two letters, or like first letter is a type of registrant. That means whether prescriber is a physician, dentist, or other healthcare professionals. Who are those healthcare professional? Designation goes with the A. And then let's say physician will have A. And then next letter, letter B in this case, the last name, first letter of the last name of the physician. That's the letter B. Usually first letter of the registrant last name. And then you have six numbers here, in this case 1 to 6. Those are called unique identifier numbers for each DEA valid numbers. And then last one is checksum test. So basically here I like to explain you how this checksum test is used for validation. So in this checksum test, here number is 3. So for example, here for this number, you have to take first digits like 1, 2, 3, 4, 5. There are 6 digits here, for example. So from 6, here there are 6 digits. So from this 6, step 1, take 1, 3, 5. So like every alternate number, but do not take this checksum test number. From the unique identifier 1 to 6, you take 1, 3, 5 first. And that if you add this 3, its total is 9. So the second step is you take 2, 4, and 6. So therefore, if you add this 2, 4, 6, it's 12. And multiply this 12 two times, so it gives you 24. And now you add this step 1, 9, and 24. It becomes, if you add these two, it will be 33. So in the 33, the last digit is 3, obviously. So this 3 matches to this checksum number. So therefore, you can say this number, which is AB1234563, is a valid DEA number. So these are the steps required for practicing this type of question. So if you practice this slide once or twice with different numbers, I'm confident this makes you confidently you can select the whether number is valid or not. All right, let's go to the next question. How many tablets are dispensed to a prescription of prednisone 5 milligram tablet with below direction? So here in the direction, these are the direction for the tablets. So if you add these tablets, whether you will get 16 tablet A, B 32 tablets, C 64 tablets, and D 98 tablets. So pause the video again and calculate this number of tablets and select the correct answer. The correct answer is 32 tablets. Let's solve how do we get it. So basically here, first thing says 3 tablets BID for 2 days. So first one, 3 tablets BID for 2 days, which is equals to 12 tablets. Next one is 3 tablets once daily for 2 days. So if you multiply them, it comes to be 6 tablets. Then third step is 2 tablets BID twice daily for 2 days. So that will be 8 tablets. And then fourth one tablet daily BID for 2 days. So if you do that, you get 4 tablets. And finally, the last one tablet daily for 2 days, which is equals to 2 tablets. So if you add this 12 plus 6 plus 8 plus 2, if you add all of them, that would be equals to 32 tablets. So 32 tablets is the correct answer for this question. Next, liraglutide, the brand is Victoza, zero point 0.6 milligram per 1 ml, zero point 0.1 ml dose. That's a prescribed dose. However, liraglutide comes in 18 milligram for 3 ml. So that is the Sig is direction is 1.8 milligram subcutaneous daily. So how many Victoza pens are dispensed for 30 days? So here each pen is uh, 18 milligram and it is 3 mils. So let's see, one pen or 2 pens. This is to supply for 30 days. 3 pens and then 4 pens. Correct answer is 3 pens. Let's solve how to do it. So here the Sig direction is 1.8 milligram subcutaneous daily Victoza have to be administered. So each pre-filled pen contains 3 ml of solution, which is containing equals to 18 milligram of liraglutide. So daily dose was prescribed is 1.8. So therefore, how many days one pen can be used? That is, one pen has 18 milligram and daily you're taking 1.8. So 18 milligram will be good for 10 days. So, but prescription is for prescribed for 30 days. So, one pen for 30 days, 10 days. So, for 30 days would be equals to 10 pen, 3 pens. Sorry, the correct answer is 3 pen. So, that's your answer for this Victoza pen supply. Right. What about those first, like basically a multi-dose pen can deliver 30 dosages of zero point 0.6, 15 dosages, like 10 dosages, which is here we are using 1.8 milligram for 10 dosages. All right, so next comes to the how many grams of zinc oxide ointment must be mixed with 10% ointment to prepare 120 grams of 15%. So basically, you have to prepare 15% of 120 gram of zinc oxide. But your pharmacy has 20% zinc oxide and 10% zinc oxide. But your pharmacy doesn't have 15%. So how do you prepare that 15% from using these two concentration? One is a 10% concentration, other one is 20%. So correct answers are here: A, 40 grams of 20%, 80 grams of 10, B, 60 grams of 20 and 60 grams of 10, C, 30 grams of 20 and 90 grams of 10, and 20 grams of 20 and 100 grams of 10. Correct answer is to prepare this preparation, you need equal parts of 10%, which is 60 gram, and also 60 grams of 20%. So if you use 60 grams of each, total will be 120 grams of 15% ointment. So let's solve how do we get it. So if to get this calculation, you can use method called alligation method. So in alligation method is used for mixing two mixtures and then to get one new concentration. So you arrange that here on the left hand side, you have a 20% and then you have 10%. So in the middle, use the desired concentration that is 15%. That's the prescription for. So now if you diagonally subtract 10 minus 15 or 15 minus 10 is 5. 20 minus 15 is 5. So you have to take 5 parts of 20% and 10%, 5 parts of 10%. So that means the ratio is 5 to 5, which is equals to 1 to 1. That means you have a 120 grams. So you should take 1 to 1 means 120 by 2. So that gives you each part 60 grams. So therefore you should take 60 grams of 20% and then take 60 gram of 10%. If you mix them together, so you will get a new concentration that is 15% of 120 grams. Next, a pharmacy purchases product for $6. If the pharmacy wants to make 50% profit or markup based on the cost price, what should the retail price be? A. $10, $12, C. $9, D. $16. Correct answer is $9. So if you sell with the 50% markup for $6 product, the product price will retail price will be $9. Let's solve how to do it. So this is the formula for retail price. Retail price formula is cost plus cost multiplied with percentage of markup. So if you plug in this number into this formula, so for example, cost was $6. And now you also have a $6 cost and markup is 50%. 50% is equals to 0.5. So therefore, if you do that, you get 6 plus 3. If you multiply this through, you get 3. So 6 plus 3 is equals to $9. So $9 is the retail price for the product that purchased for $6, but you sold it with the 50% markup. Next, Grisofulvin, which is antifungal oral suspension, contains 125 milligrams of 5 mils. A physician prescribed 250 milligram twice daily for 2 weeks. How many milliliters of oral suspension should be dispensed? A. 140 mils, B. 280 mils, C. 420 mils, D. 560 mils. Correct answer is 280 mils. So 280 mils is the correct answer. So let's do how to do that answer. For example, to get this 280 mils, so let's solve this. So here daily dose was prescribed is basically uh, 250 milligram twice daily for 2 weeks. 250 milligram twice daily means per day is 500 milligram. So for 2 weeks means 14 days. So if you multiply that, that's equals to 7,000 milligram. However, this comes in 125 milligram per 5 mils. So now you just do cross multiply. So cross multiply can be done by pointing the arrows. So point the arrows to the x. So if you point the arrows like here, so 125 to x mils and this one. And now place them into cross multiplication. So here milligram is gone. And now you get here If you divide that, it comes to be 280 mils. So therefore, your correct answer is 280 mils. Next, a bottle contains 2 grams of cefuroxime powder. After adding 20 mils diluent, the label states concentration is 100 milligram per mil. How many milliliters should be administered to dose 250 milligram? A 2 mils, B 2.5 mils, C 5 mils, and D 6 mils. Correct answer is 2.5 mils. Let's solve how to do it. Basically, here you have final concentration is 100 milligram for 1 mil, and you need is 250 milligram. So X how many mils? So again, do the same cross multiplication by pointing arrow to the X. So then cross divide them. So your answer would be 2.5 mils. That's your correct answers. Next, which part of the NDC number identifies the product code that include drug, strength, dosage form? A. First segment, B. Second segment, C. Third segment, D. Lot number. Correct answer is second segment. So here you have this NDC code. NDC code is National Drug Code for unique 10-digit codes for identifying drug products. So that is divided into 3 segments, which is a labeler, drug, and package. Just to let you know, some students have asked for in if you are reformatting for FDA billing electronic claims, you have to add 0 before the labeler. So therefore, in that case, NDC code will be 11. Otherwise, standard NDC code is 10 digits. So first labeler, first 4 digits are about the manufacturer of the product, like whosoever manufacturing that manufacturer name. Second is about the specific drug that includes drug name, strength, and dosage form. Whereas the last 2 digits are considered the package size that include how many tablets in that package. So therefore, the correct answer, the middle segment, which is drug segment, is details about specific drug strength, dosage form, and package size. All right, so next, a pharmacy technician alerts pharmacist for prescription of antibiotic, sulfamethoxazole trimethoprim, in short, that is SMX-TMP or brand name Bactrin, for the patient with a history of A. Penicillin allergy, B. Sulfa allergy, D. Aspirin allergy, peanut allergy. Correct answer is sulfa allergy. Sulfa allergy has a cross sensitivity with sulfamethoxazole. Easy to remember, the name has sulfur. Anything that has a name in the sulfur, most of them has a cross allergy to sulfur drugs. Next, a prescription SIG indicates 1 GTT OU QID 10. It can be interpreted as instill 1 drop in both eyes 4 times a day for 10 days. Instill 1 drop to the right eye 4 times a day for 10 days. Instill 1 drop to the affected ears 4 times daily for 10 days. Instill 1 drop to the left eye 4 times a day for 10 days. Correct answer is A. Instill 1 drop in both eyes 4 times a day for 10 days. Let's break down. So in this prescription, you have a 1 GTTS. That GTT refers to drop, 1 drop as prescribed. And OU is refers to the both eyes. QID is 4 times daily and 10 for 10 days. So therefore, instill 1 drop in both eyes, OU for both eyes, 4 times a day for 10 days. Next, a patient's IV infusion is running at 30 drops per minute. Which drop factor? With a drop factor 15 GTT per ml. How many milliliters per hour is patient is receiving? A, 60 milliliters per hour. B, 90 milliliters per hour. C, 120 mils per hour. D, 140 mils per hour. Correct answer is 120 mils per hour. Let's solve that one. So here the drip rate equals volume into drip factor by minute. So in this case, drip rate was 30 drops per minute and there was per hour has 60 minutes. So if you divide by drip factor, that was 15 drops per mil. So therefore it comes to be 120 milliliters per hour. That's the rate of infusion. Next, you have 89% camphor liquid available, which is a stock solution. How many milliliters of this stock solution required to prepare 60 mils of 2% camphor solution? A, zero point 0.9 mils, B, 1.3 mils, C, 1.5 mils, and D, 2 mils. The correct answer is 1.3 mils. So in this case, how to do this one? So this is the dilution method. So to calculate the dilution method, use C1 V1 C2 V2. So here is this one is C1, and then you need V1. So you need to calculate V1, and then you have a C2 which is 2%, and then here you have a V2 that is 60 mils. So if you place them like V1 equals C2 V2 divided by C1. So here already we have C2 V2 which is 2 and 60 and 89% is C1. So if you multiply this, it comes to be 1.35 and approximately 1.3 mils of 89% of camphor liquid is required to prepare 60 mils of 2% camphor solution. Next, a medication label rates 5 milliliters every 4 to 6 hours PRN. What is the maximum number of doses patient can take in 24 hours? A, 2 dosages, B, 4 dosages, C, 6 dosages, D, 8 dosages. Correct answer is 6 dosages. So if you break down every 4 to 6 hours. So when you have a 4 to 6 hours, means you should take always higher frequency. 4 is higher frequency because it is maximum number of time. So if you divide this 4 by 24 hours, then it gives you 6 dosages maximum per day is for this prescription. Next, what is the day's supply for this prescription? RX Timolol 0.25% solution 1 GTT OU twice a day for 5 mils. A 5 days, B 10 days, C 20 days, and D 25 days. Correct answer is 25 days. Let's solve how to do it. So the question of SIG is direction is 2 drops twice day, in a day 4 drops. So by default, you should memorize this. 1 mil has 20 drops. So that means here bottle is 5 mils. So 5 mils will have 100 drops. So basically you have day supply formula. Total amount dispenses 500 drops and in a day you're using 20 drops. So if you divide 4 drops per day. If you drop 100 by 4, that is equals to 25 days. So basically this prescription is for 25 days. Next, a patient has an insulin prescription states inject subcutaneous QAM 20 units, subcutaneous QPM 20 units, 10 in the morning, 10 in the evening. The pharmacy dispensed 10 mils of vial of insulin which contain 100 units per ml, what is the day supply? A 10 days, B 20 days, C 30 days, D 40 days. Let's see, answer is 30 days. Solve this one. So basically here question says patient takes daily 10 units in the morning and 20 units at bed evening. So total daily dose is 30 units. However, each vial has 100 units per ml, so 10 ml vial. So if you multiply that, each vial contain 1000 units of insulin. So now just divide 1000 total units divided by daily units. So it comes to be approximately 33 days or 1 month of supply approximately as based on the insurance policies. Next, a prescription written as albuterol 90 microgram inhaler, inhale 2 puffs every 4 to 6 PRN. Dispense one inhaler containing 200 actuations. What is maximum days supply if patient use it every day? So, for example, 10 days and 15 days, 20 days and 25 days. Correct answer is 25 days. Let's solve how to do it. So here question prescribed for every 4 hours. Every 4 hours means 6 dosages per day. And then each dose is 2 puff. Inhale 2 puff here. And then further daily puffs would be 6 dosages into 2. Daily puff will be 12 puffs. So like total actuations are 200. So therefore 200 divided by 12 puffs, so it gives you 25 days supply. Next, a patient required topical 2%, 2.5% topical lidocaine. The pharmacy has 5% lidocaine. How much of 5% is needed to prepare 100 ml of 2.5%? So basically, this one can be used by dilution method. So let's do A 25 mils, B 50 mils, C 75 mils, D 5 mils. Correct answer is 50 mils. So 50 mils can be used. How do we get those 50 mils? So that can be done by using dilution method, that is C1V1 equals C2V2. So here C1 is basically 5% and we need to calculate how much of this 5% needed, which is a V1. Our concentration is 2.5 and there is a V2 is 100 mils. So if you do that, V1 equals 2.5 times 100 divided by 5. So it gives you 50 mils of 5% solution required to prepare 2.5% of 100 mils of solution. Next, how many grams of drug is required to prepare 100 mils of 1 to 15 solution? That's a ratio. 5 grams, 6.6 grams, C 7.5 grams, D 15 grams. Correct answer is 6.6 grams. Let's solve. So here 1.5, 1 to 15 ratio. That means 1 to 15 means 1 gram of drug in 15 ml solution. So now you have to prepare it for 100 mils. Here just for 15. So now how do we do that? 15 mils has 1 gram. And then obviously 100 mils have a how many grams? So now you do the cross multiply. To cross multiply, point the arrows to the x, and then if you cross multiply, it comes to be 6.6 grams. And this 6.6 gram of 1 to 15 solution, if you add to the 100 mils, so it comes to be 1 to 15 solution of 100 mils. Next, which USP standard provides guideline for safe handling of hazardous medications? A 797, B 800, C 795, D 701. Correct answer is 800. USP chapter 800 set the standard for handling hazardous medication. Next, a patient is ordered to receive 1000 ml of normal saline over 8 hours. The IV tubing has drip factor 15 drops per ml. Calculate flow rate in drops per minute. There are two ways flow rate can be calculated: drops per minute or mils per hour. So here we are calculating drops per minute. And previous question we did mils per hour. So here A 31 drops per minute, 20 drops per minute, C 15 drops per minute, D 40 drops per minute. Let's solve. Answer is 31 drops per minute. So here question is asking flow rate in drops per minute. So here the question is flow rate time volume multiplied by drop factor, which is 15 drops per mil, and the time is 8 hours. So 8 hours, if you multiply with 60, that gives you 418 minutes, because answers are a minute. So you multiply 8 to 16, that gives you 480 minutes. So if you calculate, you get 31 drops per minute is the flow rate of this prescription. Next, calculate the number of millimoles of 0.9% sodium chloride solution if 1 liter is provided. A. 58 millimoles, B. 154 millimoles, C. 116 millimoles, and D. 100 millimoles. Correct answer is 154 millimoles. Let's solve. Basically, the formula is weight, or which is a 0.9% of means zero point 0.9 grams in 100. However, this is for liter. So you multiply this zero point 0.9 into 10 times, that gives you 9 grams. So total weight of salt, normal sodium chloride, is 9 grams. And molecular weight of sodium chloride is 58.4 grams per mole. So it calculate that, then it comes to be 50 millimoles of 150. So 1 liter of normal saline has 154 millimoles. Next, how many milligrams of epinephrine is required to prepare 20 ml of epinephrine with concentration 1 to 200 weight by volume solution? A. 50 grams, B. 100 grams, C. 150 grams, D. 200 milligrams. Sorry, 50 milligram, 100 milligram, C 150 milligram, and D 200 milligram. Correct answer is 100 milligram. So let's solve here. We need 20 mils of 1 to 200 weight by volume. That means we need, that is 1 gram of solute or a powder epinephrine in 200 mils. So therefore convert this milligrams. For you need here 1 gram, it is equals to 1000 milligram. And now you have 200 mils has 1000 milligram, and that's a cross multiply. And 20 mils is how many milligram? So if you cross multiply and then divide it, you get 100 milligram. So therefore, to prepare 20 mils, you need 100 milligrams of epinephrine. Next, a prescription requires 150 mils of liquid medication. What is the smallest bottle size in ounces that would be sufficient to fill the prescription? A. 2 ounces, B. 4 ounces, C. 6 ounces, D. 8 ounces. Correct answer is 6 ounces. So basically here each ounce is equals to 30 mils. So 6 ounce contain 180 mils. So you need to prepare for 150. So the closest one is 6 ounces. That's the closest for filling 150 mils of liquid. Next, if one application of topical cream that covers entire body for all adults 20 grams, how many grams of cream would be needed if prescription instructs to apply 30% of body twice daily for 7 days? A. 20 grams, B. 30 grams, C. 84 grams, D. 7 grams. Correct answer is 84 grams. So let's do easy one. So here you have 100%, means entire body. Entire body refers to 100%. And that required 20 gram. But here question says only applying 30% of the body. So for 100%, 20 gram. For 30% would be 6 grams. And now 6 gram for each application. So for 7 days, prescription is for twice daily for 7 days. So if you multiply 6 gram twice daily, 12 gram for 7 days, that would be 84. So you have to dispense 84 grams of cream to apply 7 days. Next, a pharmacist wants to use 2 lots of fluconazole ointment, one with the 50% and another one is 5%. In what proportion should be mixed to prepare fluconazole 10% of 60 grams? So this one here, you want to make 10%, but your pharmacy has 50% and 5%. So let's see how do we do that. 1A, 6.6 grams fluconazole and 6.65% fluconazole, and then 53 grams of 50% and 53 grams 5%, 6.6 grams of 50% and 53 4 grams of 5%, and 53 grams of 50%, 6.6 grams of 5%. So the correct answer is C. Let's solve how do we do that. So here this can be done by alligation method. So this is the aiming. You want to desired concentration. Desired concentration is 10%. And your pharmacy has 50% and 5%. Subtract diagonally. So subtract diagonally, 50 minus 10 is 40 and 5 minus 10 is 5. So now you need to total parts is 5 plus 40 parts. Total parts are 45 parts. So now for this 5%, you multiply 5 divided by 45 total parts and you're preparing for 60 gram. So therefore it comes to be 6.6 gram. Whereas this 5% one is 40 divided by 45, 53.4. So basically you add 53.4 grams with the 6.6 grams together. If you add these two combination and mix together, the new concentration would be 60 grams of 10%. So that would be your answer. All right, with this, some difficult questions. Stay tuned and subscribe Pharmacy Prep channel. We have many more exciting practice mock exams and questions coming up for your board exam preparations. Until then, stay tuned. Thank you. Bye.